Dear colleagues, dear friends, first of all, I would like to say that I'm happy to be here again in my favorite city, Cairo. Thank you for the kind information, dear chairperson. Thanks organizing committee to inviting me because it's pure happiness to be here. First of all, again, I just want to say that if you need something for the presentation, just write me to this email, which is written here. And of course, the topic of long-standing type 1 diabetes has a lot of problems, but also there are some solutions, and I will be happy to share them with you. What about agenda? We will discuss how world is changing for type 1 diabetes patient, main clinical problems, new questions, of course, new answers and solutions, and after that will be conclusion. I just want to start with the voting. How do you think? What does it mean, long-standing diabetes? Who are you thinking that it's about 15 years of type 1 diabetes? Just raise your hand. 15 years? No one? 20 years? 25 years? So there are no official definition for this. And in a lot of publications discussing years and years of type 1 diabetes, but most of them use 25 years of life with type 1 diabetes as described in for long-standing type 1 diabetes. And of course, for last years, there is transformation of illness from the era of no insulin to insulin available with increasing of life expectancy, but vascular complication, knowledge of pathophysiology, introduction of HbA1c level, and self-monitoring blood glucose. And of course, with a lot of studies, DCT, UKPDS study, risk factor evaluation, prevention, and self-management central in diabetes care. Just to remind you, just 1 century ago, the only treatment for type 1 diabetes patient, it was starvation diet. And you can see here, as example of starvation diet, is like 200 calories per day for child with type 1 diabetes. And now we have type 1 patients who live in years and years and even work in as top models and use all these modern devices. So if you just want to discuss some current issues in type 1 diabetes and its management, of course, the incidence and prevalence is continuously increasing, unfortunately. According to estimates, it affects 15 out 100,000 persons globally. In Europe, a doubling of type 1 diabetes cases has been predicted in children younger than 5 years of age during the last 2 decades. In comparison with general population, people with type 1 diabetes have considerably elevated risk of cardiovascular disease and shorter life expectancy. It's very important. Average HbA1c level is still 8.5 almost, is data from type 1 exchange registry. Not all patients achieving their glycemic goals, and hospitalization due to hypoglycemia, 4% in the United States will have at least 1 severe hypoglycemia per year. Also, it's very important that life of our patient is still an art of balance between hypoglycemia, hyperglycemia, dysglycemia, risk of complication, acute and chronic. So it's not very easy to live as a person with type 1 diabetes. Also, for patients with type 1 diabetes, hypoglycemia, hyperglycemia are not just words. If you will think about it, of course, if it's their time, it's their security, if their efficiency, anxiety, depression, added stress, danger, cognitive function, mobility, possibility to social interactions, demanding things, influence on behavior, capacity to action, possibility to act and sleep. And so even much more. I just wanted to prepare a simple list for you. And of course, there are some issues with duration of diabetes. And if you're just trying to find some publication on this topic, you can easily understand that there are some association between diabetes duration and even monocyte count. In this publication, it was a possibility to find even interaction between pro-inflammatory markers and duration of type 1 diabetes without any connection with HbA1c level, just with duration. And it's very important to keep in mind of our clinical work. Of course, because of that, maybe not only because of, but maybe also because of it, life years lost in relation to age of onset type 1 diabetes is also important, and it's still an issue because years and years patients are losing because of type 1 diabetes. Another important thing is that C-peptide in this patient are still possible to measure, and there is connection between C-peptide level and amount of hypoglycemia even in long-standing diabetes type 1. Okay, there are some words about pathophysiology, but also we need to remember about additional things. And I just want, as example, show you the example of my patient with type 1. She's 70 plus years old, and she increased the level of HbA1c for 2% for last 3 months. And when I asked her relatives just to make a video with injection technique, it was trouble, because if you just look here, it's easy to understand that insulin injection was wrong. No insulin was coming into her because sometimes she forgot to put off the cover from needle. And of course, not only cognitive impairment, but also comorbidities are a problem, complication of diabetes, also burnout, diabetes distress, and polypragmasia. So in this way, I think that we need to remember about necessity of simplification of therapy, not about clinical inertia and necessity to push the patient into different, very difficult sometimes insulin regimens or some additional therapies, but also for simplification, especially for patients like this old lady who don't remember to put off the cover of needle. What is the patient role here? Because the patient must share decision making and goal setting. It's very important with working with that. If a patient needs more education, give it, even for patients 70 plus years old. If meal planning and carbohydrate is an issue, referral to dietitian, it's possible. For some individuals, referral to mental health provider can help them. Patients should be encouraged to download and internet their own data as much as helpful, from glucometers, from CGM, from insulin pump. Education is the key, and of course change it more often than every 3 months if you need it. Why I just started to discuss technology here? Because again, data from the One Exchange registry, as you can see here, even in patients 65 plus years old, there are some of them who use pumps, sensor, or even closed loop system. Because of that, the rate of hospitalization for this patient is still high because of long duration of diabetes, because of comorbidities, and we need to know about common medical conditions during hospitalization that affect insulin therapy and CSI management. It's a simple table, and it's very useful to remember about it during your practical hours with patient. Of course, there are some recommendations for insulin pump and CGM usage during common and patient imaging studies procedures, because there are a lot of patients with very, even very old patients who can use it. And sometimes we need to remember that it's easier to discontinue insulin pumps than to perform it during the hospitalization. And there are some things which we need to do here. Of course, when we're thinking about technologies in all modern era and changes and differentiation of approaches in disease treatment, we need to still remember about very simple things. It's again the patient of mine who came to an appointment several weeks ago, 40 years old, diabetes duration 31 years, and very high HbA1c level. And if you can just look here, the reason is very simple, is changing in places where he put insulin. And of course, there is in not all cases, it's very easy to understand what's the problem. And here we can use ultrasound examination. And if you look here, you can just easily understand what's going on in subcutaneous tissues. And my suggestion is usage of this method more in patients with long-standing type 1 diabetes, because it can change their life, and insulin injection technique. Of course, new reality with all problem is also a problem that humans are always human, even in this age, even with long-standing type 1 diabetes, and they still fear of hypoglycemia, have some problems with numeracy, data overload, excessive time requirements, technology literacy, and device incompatibility. But what we can do here, is it just we can say that it's possible to change anything for such patient because world with type 1 diabetes is very difficult for them? Of course we can do something, and our example from last 6 months, we just start online interventional programs for people with type 1 diabetes who live with this disease more than 20 years, and this data is still unpublished, but I hope that it will be someday, and it's more than 200 people, and we just observe them for 3 months period, which HbA1c level examination is 10 lectures pre-recorded by myself, 3 physical training lessons, recipes from dietitian, chat with endocrinology residents on WhatsApp, video streams once per week for 1 hour with all team, with possibility to ask a question from dietitian, from physical training specialist, from me, and the results here, you can see that even if patient live with diabetes more than 25 years, it's possible to improve HbA1c level. It's possible to use CGM more often without telling that it's very difficult, because it's a good motivational point even for education of our patient living longly with type 1 diabetes. So approaches to overcome barriers in patients with long-standing type 1 diabetes is right time of treatment change is important as soon as patient needed, family support and psychological issue matter, extended outreach and support in new wave, maybe through online intervention, realistic expectation and achievable goals even for the miracle technologies like CGM or CSAI or even closed loop. Reasons to know this information that of course we need to know that we not only need to decide the clinical problems, but also we need to understand the person's current life situation, values and capacities. And I would like to finish my lecture with the words of Elliot Jocelyn, who described determinants for long survival with diabetes, and one of them is the willingness of the physicians to provide the best treatment with modest medicine effort. So our patients with long-standing type 1 diabetes need it for us. Thank you for your attention, and of course, thanks for my patients who work with me and living their long life with diabetes. And the average duration of diabetes from patients who is on this picture is 22 years old. So it's possible, and again, my mail for your answers or maybe questions for something if you need.